Hi, I'm Mike Cantrell, Data Science Manager at Parcel, and today I'm going to talk about how data and risk management will support effective and equitable vaccine distribution in emerging markets. A bit about Parcel. Parcel's purpose is to build a world where everyone, everywhere, can trust the quality of goods they rely on, from the foods they eat to the medicines they need. The way we're working to achieve that is by building a fully integrated supply chain data and cargo insurance solution for perishable supply chains. Our roots are in monitoring vaccines, and we've been partnered with Gavi since 2018, and we became a cargo insurance provider last year. This pandemic has led to a renewed, if not unprecedented, focus on the importance of robust supply chains, in particular cold chains, and the unique requirements of maintaining temperature-sensitive vaccines, especially in hard-to-reach places. Currently, there's little to no data on baseline risk of vaccine spoilage after arrival in country. Our approach is to use small and affordable sensors and data analytics to understand and mitigate risks. Our solution is designed for low connectivity environments, and our mobile and web apps are designed to be as intuitive and easy to use as a modern consumer app. For a quick look at our product, we make our own sensing devices designed for affordability and scale because more data means better insights. Data is offloaded from our devices using our mobile app or a stationary gateway. Our mobile app also provides real-time actionable information and alerts. Finally, all of a customer's data is visible on our web platform, where we add context such as location, mode of transit, and asset performance. Providing insights via mobile enables a data-forward culture, turning frontline workers from data collectors to data users. Here is an example of what COVID vaccination frontline workers would see. They're able to scan a QR code on the outside of a refrigerator or package and quickly understand temperature information and ascertain if the vaccines are being properly maintained, all without having to open the fridge. On the previous slide, we saw how data and technology enable point-in-time intelligence, such as, this vaccine is safe and effective to administer right now. These insights are incredibly valuable, but it is also critical to learn from past successes and failures to ensure that the point-in-time insight is always, this vaccine is safe. Parcel applies machine learning to our customers' historical data to uncover trends and patterns and predict future performance and risk to help our customers get smarter with every shipment. Some example insights. Well, perhaps unsurprisingly, the damage done by refrigerators follows a power law. The top 5% of worst behaving refrigerators cause 48% of total harm to vaccines, while the top 10% cause 65%. In this case, fixing just the worst fridges would cut vaccine damage in half and save lives for pennies on the dollar. We've also seen that freeze damage is by far the biggest risk to cold chain vaccines in transit, while heat damage is the biggest risk in storage. In one country, vaccines had a nearly 1 in 4 chance of spoiling due to freezing temperatures. And finally, we also found that reducing the time vaccines spend in the cold chain, particularly the last mile, by 12 weeks, would cut the number of spoiled vaccines in half. Now I want to go into a little more detail into how we produced this last prediction. We've been working on virtual supply chain simulations that mirror real-world supply chains, allowing our customers to understand different levers they can pull to make the largest improvements in quality with the least effort and cost. For example, a user can simulate replacing refrigerators of type X with type Y and see the projected impact on vaccine health across their entire cold chain. Similarly, they can simulate changing their shipping schedule. For example, after seeing that the last mile had a disproportionately negative impact on vaccine health, one can use this tool to quantify the positive impact of speeding that portion up. Parcel grew out of the belief that data and technology can reduce spoilage in sensitive supply chains. We've quickly come to realize that risk management and insurance are two sides of the same coin, and that shipment-level data allows for innovative ways to manage and transfer risk. Today, ensuring vaccine stockpiles in developing countries is prohibitively expensive for ministries of health and the broader global health community, because there is little to no data on baseline risk of vaccine spoilage after arrival in country. Consequently, these critical goods are regularly under or even uninsured, a problem that's even more acute as the world distributes COVID-19 vaccines. But with a sensor that can monitor temperature in this way, health workers on the ground will have the insights they need to prevent losses from occurring, and underwriters can accurately model risk. This is the idea behind the Global Health Risk Facility that launched earlier this year, created to bring insurance and risk management for COVID-19 vaccine delivery to developing countries. The facility is backed by the U.S. government and was created to bring risk management services like supply chain risk evaluations and technology-enabled data collection and insurance coverage enabled by smart sensors to the distribution of COVID-19 vaccines and other health products in the developing world. It is critical we protect every dose everywhere. Ensuring vaccines and global health commodities with data-driven solutions is essential to protect both the quality of the goods as well as the financial investments made to supply and distribute them. Thank you to the Global Digital Development Summit for hosting this event and for inviting us to speak. To learn more about Parcel, please visit us at parcel.com. I'm also happy to answer any questions you may have. You can contact me at mcantrell@parcel.com. Thank you.